What's the best brace for knee osteoarthritis? Hi, I'm Dr. Dave Candy. I'm a board certified specialist in orthopedic physical therapy, and in this video I'm going to explain what the best type of brace for knee osteoarthritis is. Now, the best type of braces for osteoarthritis in your knee are types of braces that unload the knee joint, that if you have arthritis and the two joint surfaces are compressing together, that compression, when you don't have cartilage between the two bones of the knee, the femur on top and the tibia on bottom, that can create inflammation in your knee. And so the braces that you want to use for knee arthritis are braces that unload or decompress the knee joint. Now, a lot of the braces for knee osteoarthritis, they use a 3-point pressure system. So it bends the knee inwards or outwards and gaps one side at a time. So if you have arthritis on the inside of your knee or medial knee arthritis, you'd want a brace that presses in this way and it gaps the inside like that. Now, the downside of that is it also compresses the outer compartment. So while you're gapping the inside of the knee, you're also compressing on the outer side of the knee. Now, if you have arthritis on the outer compartment of your knee or the lateral compartment, you'd want a brace that has a pressure point going that way, so it applies a force, a varus force, and it gaps the outer side of the knee. Now, vice versa, that compresses on the inner side of the knee. So what if you have osteoarthritis in both the inside and the outside of the knee? Then those braces don't work very well. Now, another downside of most knee osteoarthritis unloading braces are that they're very, very bulky. They're big and bulky and they're cumbersome. I've had patients who they've had to wear them on both knees and the braces rub together on the inside because they are so big and bulky. So what do you do if that's the case for you? Well, I found a brace by DDS Solutions or Disc Disease Solutions. I actually like a lot of their unloader braces for the lower back, but I didn't know they made one for a knee, and they actually sent me a brace that I'm going to show you in this video. It's called the OA Pro, and as you can see, this is a fairly small slimline brace, which already has an advantage over a lot of the knee unloader braces that are kind of big and bulky and cumbersome. But this brace you can fit under clothes, you can fit it under pants, and the other advantage to it, which I think is really unique, is that it unloads both compartments of the knee at the same time. A lot of them, you have to turn a key to adjust the knee torque to go more one way or to go more the other way. And this one doesn't require that either. So it is a little bit more user-friendly. So again, this is the Knee OA Pro, and I'm going to show you how you use that and why it works and why it may be a better option, especially if you have knee arthritis on both the inner compartment and the outer compartment of your knee. So to put it on, you can see it just has Velcro straps like this. You'd want to loosen those Velcro straps or undo them completely. You don't need to take it all the way out of the brace. Just get them to where they're loose and you can slide the brace on. Then you want to sit in a chair and slide your leg through the brace. And you want to pull it up with your knee straight like this. And it's really important to get this hinge right here aligned where your knee joint bends. So that's the first step, is to get it aligned where the knee joint bends. Then you want to get this lower strap positioned first. You're going to take both ends, make sure that the hinge is staying aligned with your knee joint. You're going to pull both ends with an even pressure. You want to try to get it fairly tight and then strap them around and Velcro them in the back. Now here's kind of where the magic of the brace happens. So this part is very important as well. That you want to bend your knee to 90 degrees. Make sure again that this hinge is lined up with the knee joint. And then you're going to position the top part, again making sure the hinge is lined with the knee joint, and pull equal pressure on both straps and fasten them around on the back of the brace. Now you can see pant leg fits over it rather nicely. If you're wearing long pants, you'd want to put the brace on and then pull your pants up. But now, because the knee is bent when you put it on, when you go to stand up, it applies an upward force against the brace as your knee straightens. And so it's distracting the knee joint. It's lifting up on the knee and taking some compression off your knee. So it unloads both the inside compartment and the outside compartment of your knee, so that if you have arthritis on both sides, that it unloads both compartments at the same time. The other advantage is that because you're not compressing one compartment, you're less likely to make that wear down over time. So if you're being pressed in that way, it compresses the lateral compartment. If you're being pressed this way, it compresses the inner compartment. And with this brace, it just vertically lifts up. It's an upward pressure, not a side-to-side pressure. So hopefully that helps you to understand if this brace might be helpful for you. If you feel like it is, then I'll put a link in the description here below this video. But just understand that knee braces, they're something to help take the symptoms away if you do have knee arthritis, but there is ultimately something that caused that arthritis in the first place. Some muscle imbalance, some movement dysfunction, some difference in the way that you walk that has caused a gradual wearing down of the knee cartilage over time. And ultimately, you do want to address that, because there are probably times where you're not going to want to wear a knee brace all the time. If you're walking around the house or just going short distances, you may not want to have a knee brace on all the time. So if you'd like to be able to get around more comfortably without always having to wear a knee brace, it is helpful to find out what the root cause of your knee arthritis was and undo that. So getting muscles stronger that were weak, getting muscles more flexible that weren't flexible enough, improving your gait or walking pattern, getting the appropriate arch support in your shoes. All of those are factors to consider if you do have knee arthritis in order to get a longer term fix so you're not relying on a knee brace. So if you are in the St. Louis area and you need help to figure out what's causing your knee arthritis pain and to help get some relief from it, to address those underlying root causes, we'd be happy to help you out here at More for Life. Just contact us at our office and we'll get you scheduled for an appointment. And if you're watching this video from somewhere else but you found it helpful, give the video a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching and have a great day.